see, this is what is happening in Minnesota. People in Minnesota should no longer be suffering the way we are currently. And most importantly, it is way overdue to help these counties, Ramsey counties, Hennepin County. The HCMC is dealing with a lot. Issues like the health care.
By definition, a socialized medicine type system of paying for health care would mean that the hospitals, the clinics, all of the facilities would be owned by the government, and all of the workers would be government employees. Mm-hmm. That's not actually the system that we're proposing. We're proposing that the funding come from one source. So the government is the payer, not the provider. And except for the fact that we do have a combination of public facilities and private facilities. So what I like to tell people is that you would get your health care through the healthcare system that you're accustomed to now, or you would get health care if you don't have it. So you would either go to clinics and hospitals that would remain owned as under the current ownership, whether they are private or public. So private not-for-profit would be places like Fairview, Alina, Health Partners, used to be Health East, you know, the clinic and hospital systems that you're accustomed to. A public hospital is HCMC, so Hennepin County Medical Center is a public hospital. There are some county-owned hospitals. The hospital I worked for 35 years, University of Minnesota, was actually a public hospital. Mm. It was owned by the University of Minnesota or the state of Minnesota. Excellent hospital. So we have excellent private and public hospitals. So the healthcare delivery system remains about the same as you're accustomed to. The payer becomes a single payer, and that's the government. And it would be much more efficient to have one payer.
One question that is always coming back in my head is, if we were to go with the Minnesota health plan, and let's say I were to travel to Arizona, mm-hmm. How is that going to factor in my coverage?
You're covered.
I will still be covered?
Yes, as long as you're a resident of Minnesota, your permanent residency is Minnesota, you're covered. When you travel, you're covered if you're out of state. If you move to another state and we have a state-based plan, then you wouldn't be covered. And that's the advantage of a national health plan, which we hope to achieve one day. It would be that you would be covered no matter where you go.
I know our Minnesotan taxpayers would be wondering, well, why would I pay for somebody else? What if somebody comes out of New York and is not a resident of the state of Minnesota? Are we going to pay for that person, or how is that going to work if they're not resident of a state?
Good question. You can get care in Minnesota if you're here temporarily on vacation or just for here temporarily for some reason. We would then turn around and bill the state of New York or bill your insurance in another state.
So this would be a win-win situation then?
Yes, it's expected that there would be people who would need care who are visitors or tourists or from out of state, but there would be a process for billing their insurance.
I might add on to that, you know, we expect there will be people that move to this state for health care and become employed in this state. Mm-hmm. And that's not really a terrible thing, because we want to grow the state and grow mm-hmm. the population mm-hmm. and bring more people like yourself in who want to start a business or want to use their skills in the workforce. So
I know staffing, especially within the social service, is very, very hard right now. And I have many people, many immigrant people whom mm-hmm. over the last 2 decades I've been telling them how wonderful Minnesota is. If they were to consider coming to Minnesota and help us with our social services, this plan would be phenomenal. To just know that you can leave any other state, come to Minnesota, as Samba had said, work in this wonderful society and be covered by a health plan that is state-owned. Is that going to be state-owned or federally owned?
The Minnesota health plan would be what's called a state-based single-payer health plan. as opposed to a national health plan, which people might recognize as Medicare for all.
Okay. And as you said, single payer. So you would mean somebody working at 3M would pay the exact same amount of coverage as somebody working at, let's say, Le Courage staffing.
So there's a little bit of complexity with a state-based plan because we will probably need premiums based on ability to pay, and we will need some business tax to cover. A national health plan is proposed to be covered entirely using federal income tax. A state-based plan, we're probably going to need some premiums and some business tax because we don't have all the federal money that is currently going into our healthcare system.
And one thing
So-
that is very concerning to me is that this has been worked on since 2016.
Oh, it's actually older than that.
Older
It's
than
actually,
that?
yes. It's been, this proposal, actually, I believe Senator Marty wrote this proposal almost 20 years ago.
That's when I just got
We're
into
having-
Minnesota, and I didn't know about this.
We're having difficulty getting, it's been, as Dave said, the legislation has been introduced over several legislative sessions. We need to get hearings. So we need the public to put some pressure on their elected officials to get this attention put on this proposal so that we get hearings in the various committees in the legislature who need to hold hearings.
And that's the part
get
you
this
have to, that's the part that the
considered.
community members
Right.
needs to be doing by calling their elected officials.
So our job is to educate and organize more people to get involved and then work with legislators to craft and pass this bill.
I'm excited
But
about Minnesota.
it takes a lot of public pressure to get an issue like this raised to the level where we're actually having hearings and having votes. As you can imagine, there are a lot of interests in opposition to fixing this. And those are the people who are making so much money from the status quo that they're going to place a lot of counter pressure on the public. So we need to create more demand among voters and the public
As
to
you
counter.
have heard, I believe Ann said it all. We the people.
We the
We the
people.
people.
That's
We
right.
the people, once educated now, we need to come out.
Mm-hmm.
Let's think about the next generation of Minnesotans. This state is a wonderful asset in the world. And to keep our current healthcare system, as Dave had said about, our life expectancy is getting lower. We need to have better coverage. We need to be better educated and know more. Know more, because if you know more, we do more. And if you do more, what I brag about all the time, I live in the best state in the United States, the state of Minnesota. I believe having more immigrants, having more skilled workers, having more social service workers to take care of the many different social service needs we have in the state of Minnesota. And what do you say?
As you were talking, I was thinking that I want to point out something we haven't covered yet. And one of those, the most important things people need to know is that while we are a wonderful state to live in and while we have a great quality of life, we also have some huge disparities in health care and health outcomes amongst lower income persons and persons of color. And we believe that covering everybody without and removing the financial barriers to access to health care will contribute positively to the health and health outcomes for persons of color who are right now tend to have higher rates of uninsured and less ability to tolerate the out-of-pocket costs that are embedded in our current system.
That I have to agree
So-
100%. And as I talk to many of you, definitely the burden of not being heard, the burden of not being listened to, the burden of not having the right employment to have the health care that you deserve for your family as a people of color, that disparity that our state has been due diligently trying to address, issue like Minnesota health care plan would be a better outcome for our members of the community, people of color, indigenous societies that are really looking to be part of this health plan, that are really looking to see and hear our legislator really come on and follow what Senator John Marty and beyond have worked on. I'm just puzzled as to what is stopping them from really learning more.
There are a lot of ideological barriers and excuses, I think, put in the way of really seriously looking at and implementing something like this. One of them is the word that Dave asked, or when you use the word socialized in this country,
Medicine.
people tend to link it with welfare programs, and they link it with people who we'll just have to admit that there are negative connotations to social programs, and those are artificially exaggerated by people whose interests do not lie in fixing this. And I will defend social programs and suggest that we do a lot of things together that are really important to society. Socialized means society, which means people. We do things like public schools, public parks, firefighters, first responders, roads and bridges. We do lots of things together that benefit all of society.
Police and military.
There's police, military. There's no reason not to add healthcare to the list of things we do together that we can do more efficiently and better if we cover everybody. So I'm going to defend things like social programs like schools, parks. We also do Social Security and Medicare are extremely popular and extremely important for people in this country. We just need to extend it to all ages, not just seniors and the disabled.
As you have heard, Dave mentioned it earlier, many other countries have gone further beyond their healthcare system. We live in the United States of America. This remains and will always be the most powerful nation on earth, but we need to educate our community members. We are a melting pot. We are a community that exists nowhere else in the world. Therefore, we need to be educating our community members. I believe getting into the website that you see below would be extremely helpful, not just for you, but for the many, many generations to come. And as we know what had happened in our community, we talk about COVID, we talk about health disparity, we talk about diversity, we talk about inclusion. Thanks to our federal government that now they have added accessibility. I believe having access to a good Minnesota health plan will help our moms and dad, our elder community who are here, seeking somebody to be in their home, in their sphere, in their apartments, delivering health. And I have so much passion about assisting our elderly communities. The nurses, the doctors oftentimes don't have the time to really spend 2 hours with a patient. If we were to have a robust Minnesota health plan, it will increase our shortage of workers to work in these social services. Staffing is huge, but we have a whole lot of workforce who are afraid to come in. Why? Because as you know, they don't own much. But if we were to have at least a safety net, that if you come to Minnesota and you work for our social services, help our Minnesota State Public Health Administration or Department, you also will receive care. Because you said it, many immigrants, many people of color who have the desire to really help, oftentimes don't reach to this level. The only reason being lack of education, lack of accessibility, and there is a huge disparity that I believe what you talk about could begin to address if our legislators would respond, would listen, would learn more, because health care for all is something that I definitely believe our seniors would need, and we need to really be here to support that. Again, I cannot stress it enough. Thank you so much, because when I listened to health care for all, I thought it would have been a socialized medicine for all. But that's not what we are talking about. Again, to just refresh our memory, this is not socialization. This is not opening up for everybody to just come and dig in, but it will be to share the very fundamental basis that hold our societies, from firefighters to police officers to educators to bridge workers, agricultural farm workers, all of these. And I believe right now, if I take a look and see our seasonal migrant workers, they're not covered by any health plan.
They're often can use what you might call, if the residents here, you can apply for Medicaid, which is for very low income persons. We do have a system of community based clinics, federally qualified health centers they're called, or FQHCs, but they're not distributed all around the whole state. There are about 15 in Minnesota. There are some services for migrant workers, and that's probably something that would have to be addressed. How do we cover people who are temporary workers? Because you reside in Minnesota only part-time.
But if
But
they
nobody would be turned away.
But if they were to choose to come and live
If
in
you
our
came-
state
if
to
you-
grow the
If
state
you
of
become a
Minnesota,
permanent resident, you would be covered, yes. And a system, nothing's free, but we have a system that's costing us an outrageous amount of money, and much of it is not going to the right place, which is actually health care. The other thing is that if we freed up some of the money we're spending on the for-profit side of healthcare, we would that would free up resources that we need for education, for housing, for nutrition, for the other things that actually contribute a lot to the health of a population.
Samba around town, definitely a lot more community involvement are needed to push initiative like healthcare for all. Minnesota will
That's right.
be and will continue to be the best state in the state of Minnesota. We, the people, we need to take this state to the highest level by having a health care plan for all to make the state of Minnesota the best state in the United States. Again, Dave, you're looking at me because you know how proud I am to be living in Minnesota. I need everybody to consider within the next 5 years to come and live in Minnesota, become a permanent resident, because we will be, and we will be working towards getting Minnesota health plan, Minnesota healthcare for all happen. Again, thank you so very much. We are going to be shortly coming Samba around town. Thank you again so very much for watching.
Bye.